Hello, everyone. This is Kutsu Academia. Okay, let's dive right in. We all think we've got hand washing down, right? I mean, it's pretty basic stuff. But here's the thing. In the one place where it matters most, hospitals, it turns out this super simple act is a massive and really complex challenge.
So get this. In some parts of the world, that number is the actual risk a patient faces of picking up an infection they didn't even have when they walked through the door. 1 in 10. Just let that sink in. It's an absolutely staggering figure, especially for something that we should be able to prevent.
The official term for these are healthcare-associated infections, or HAIs for short. You can think of them as these invisible enemies lurking inside our healthcare systems, and they're a huge threat to patient safety. And guess what the number one way they get around is? Yep, on the hands of healthcare workers.
You know, for more than 100 years, the fight against these infections barely made a dent. It was just this stubborn, persistent problem. But then, a really simple innovation came along and, well, it changed absolutely everything. For the longest time, the gold standard was just plain old soap and water. But check this out. Look at what happens in the mid-90s. In 1995, a hospital in Geneva decided to try something new, alcohol-based hand rubs. And the results? They were incredible. They literally cut their infection rates by 50%. Just like that. This one change pretty much created a whole new global model for hand hygiene. So what was the big deal? Why was this so revolutionary? Well, it all comes down to the fact that for a busy hospital, this alcohol-based rub is just better in like every single practical way. You don't need a sink, right? So you can put it right there at the patient's bedside at the point of care. It's way faster. We're talking 20 to 30 seconds versus a full minute for soap and water. And this is a big one, it's so much easier on the skin. Imagine being a nurse who has to clean their hands hundreds of times a day. That makes a huge difference. Okay, so we've got a better, faster, more effective solution. Problem solved, right? I mean, everyone should be using it all the time. But yeah, it's not that simple. The data actually tells a very different, and frankly, a much more human story.
And this right here is the big mystery, the paradox of it all. Even with this amazing tool literally everywhere, getting healthcare workers to consistently clean their hands is just incredibly hard. It's that classic gap between knowing what you should do and actually, doing it.
And this chart really just lays it all out. Take a look. In low-income countries, the average compliance rate is, well, it's less than 20%. But here's the kicker. Even in high-income countries, with all the resources in the world, it's still only 40%. Think about that. That means more than half the time, a critical moment to clean your hands is just missed.
So why is this happening? Well, the reasons are just deeply human. It's not one simple thing. It's this whole complicated web of factors. Just try to picture a chaotic ER, right? Doctors and nurses are totally overworked, they're understaffed, and in a life or death moment, their first instinct is to rush to the patient. Or maybe they think, hey, I'm wearing gloves, I'm good, which is a total myth, by the way. When things are crazy, stopping to clean your hands can feel like you're wasting precious seconds, even when your brain knows how important it is.
So the World Health Organization looked at all this and realized, okay, just having a better tool isn't going to cut it. So they developed this really comprehensive strategy. They decided to attack the whole problem, not just, one little piece of it. They call it the multimodal hand hygiene improvement strategy. Yeah, I know, it's a total mouthful. But the core idea is actually really simple. It's not just about nagging people to wash their hands. It's about completely re-engineering the entire system, the entire hospital environment, to make cleaning your hands the easy, automatic, and totally expected thing to do. And how do they do that? Well, this strategy comes at the problem from every possible angle. First, there's system change, basically putting that alcohol rub everywhere you could possibly need it. Then you have training and education, making sure everyone knows the when and how. Then, and this is crucial, evaluation and feedback, actually tracking how people are doing and showing them the data. You've also got simple workplace reminders, like posters, to jog people's memory. But maybe the most important part is the last one, creating an institutional safety climate. That means making clean hands a top, non-negotiable priority for absolutely everyone, from the CEO of the hospital all the way down to the patients themselves.
And does it work? Oh yeah, the results speak for themselves. Let's go back to that hospital in Geneva, the one that pioneered this whole thing. Their compliance rates saw this huge, sustained jump, from less than 50% all the way up to almost 75%. It's solid proof that if you tackle all those human and systemic barriers, you can create real, lasting change.
Now, of course, we can't talk about hand hygiene without talking about the last few years. The whole world basically got a crash course in this stuff, right? The COVID-19 pandemic was this massive global wake-up call, and it brought a ton of attention to this really simple act.
And that really gets to the heart of it, doesn't it? The pandemic drove home just how critical hand hygiene is, not just inside hospitals, but for all of us, everywhere. It's literally our first and best line of defense against so many things.
So what this means is that we're at this really unique moment in time. We have the knowledge, we have a strategy that we know works, and for the first time, we have the whole world's attention on this. The big challenge now is just making sure that these life-saving habits are actually put into practice, everywhere, for everyone, all the time. So what's the big takeaway from all this? I think it's that sometimes the hardest challenges aren't about inventing some brilliant new gadget or a technical fix. The real work, the hard work, is understanding the messy, complex human behaviors that get in our way. And then it's about building a system that helps us all do the right thing. It really makes you wonder, right? What other simple problems out there are we failing to solve? Not because we lack a solution, but because we haven't figured out the human side of the equation. Kutsuyo Academia, please subscribe to the channel and give it a thumbs up.